Hello, Dr. Arnold Angrist. I'm a wellness expert. Been in practice in New York and New Jersey for almost 37 years. And I'd like to talk to you about what I believe are the true causes of pain and symptoms, because that's the essence of what I want to discuss, to give you a sequential order, a sequence of events of what actually causes pain and what you can do about it. So the beginning, step one, the first sequence is stress. There are three types of stresses. There's physical stress, emotional stress, and chemical stress. So let's break those down. Physical stresses, such as sitting at a computer all day, having poor posture, being overweight, not sleeping well. Those are physical stresses. Chemical or nutritional stresses, such as not eating healthy foods, processed foods, sugars, soda, alcohol, caffeine, nicotine. Those chemicals are all stressors. And then there are emotional stressors, like relationships, money, financial problems, time management, work, and school. Combine all of those stressors, and then they create the sequence of events where the next step is it creates constriction or contraction or congestion or inflammation, a decreased function of your body. So you have stress, decreased function, and then that leads to the third step, which is pain, back pain, neck pain, headaches, fibromyalgia, plantar fasciitis, low energy, anger, resentment. Those are symptoms that begin from that initial sequence of having a combination of those stressors. So now, what do you do about it? So what can you do about changing or interrupting the pattern of these three steps? The stress, to the decreased function, to the symptoms. So what we do is we teach you what I call the 5 keys to health. And the 5 keys are our mindset, the emotional component, which is how do we let go of all the stress? That stress becomes very heavy. Learning to practice non-judgment, owning inner peace, calm, tranquility. Those are some of the things emotionally that we need to do for our health. The next is physical exercise, understanding the right way to stretch properly, the right way to do core strengthening. The third is nutrition. What can you do nutritionally? Learning moderation versus deprivation, learning to eat foods without labels, learning to eat the colors of the rainbow. The next is posture, understanding how to stand properly, standing proud, owning that rather than allowing that poor posture to set in. And then sleep habits, which are key, understanding how many hours to sleep, positions to sleep, taking naps. Those 5 keys we teach in order to help you get rid of those symptoms without the use of drugs and surgery. Then, on the other side of it, we treat patients, beside teaching patients, the chiropractic aspect of healing. And many years ago when I started, I felt that why do people go to chiropractors? Why do people go to physical therapists? And why do people go to massage therapists? They're all vital and they all work. So I combined, my unique technique is combining all 3. So I do a lot of muscle work, trigger point work with my hands to get into the muscles, release the tension from the day-to-day stresses of life, and we break that up, that opens up energy and allows the body to heal. We complement that with spinal manipulation. It's a very gentle procedure to restore alignment in the body. Takes the pressure off the nervous system, opens up nerve flow, allows the body to heal. And the third component are physiotherapy modalities, such as hot packs or cold packs if necessary, electrical muscle stim, nerve stim, traction. Those 3 combined, the physiotherapy, chiropractic, and the soft tissue work restores this balance, what I call being fab. We want our patients to be fab, flexible, aligned, and balanced. So that, in a nutshell, is basically what we do. We can elaborate on all of that later. If you're interested in talking about this, if this resonates with you, I'd be happy for you to come in for a complimentary, no obligation consultation. Talk to me. You can either come in, we can do it on the phone. I hope this can help you really understand the sequence of events, what creates the pain syndromes, the problems you might be having, the conditions, and therefore do something about it. It takes a commitment, but it's very doable, it's simple, it's easy to implement if you're just ready to listen and open up your heart to really make changes in your life. Thank you very much.